Hello, men, and likely a few ladies as well. Welcome back to the Recharge Podcast. We are up to episode 137, recording this November 1st in honor of Men's Health Month. And what I want to talk about in this episode is bloody swimmers. This is something that I see from time to time in my patients in the emergency department and also during telemedicine consultations. And that is in regards to something called hematospermia. Hemato means blood, and spermia obviously means sperm, so bloody sperm. It's kind of a misnomer because the sperm isn't actually bloody. It's actually the fluid or the secretions or the semen that the sperm swim in that's actually bloody or blood tinged more likely. This is a medical term to describe the presence of blood in a man's ejaculated semen. It might be concerning. Obviously, to many people, it freaks them out. And then when they see bright red streaks of blood or clots or remnants of blood, it's essential to understand that this is not always life-threatening and most often is benign. That said, an evaluation is recommended. See your local doctor. This is an educational podcast only. I wanted to bring out a few things, though, that are important to note. Is there a connection with other conditions? Well, this doesn't typically exist on its own. It's often found alongside other things like lower urinary tract infection, bladder infection, prostate issues. The tubes or the ducts that the sperm and the semen travel through pass through, obviously, a variety of other structures besides just the penis, and this can produce or introduce blood and other things into the semen that can cause it to be odor, color, etc. The key is here to really evaluate and consider other factors. When a person is found to have blood in their sperm or their semen, we usually follow a set of protocols to try to work through this. You know, was it a trauma? Were they riding bike? Were they participating in a jiu-jitsu and got struck or kicked or something along those lines? And also whether or not there's symptoms, whether or not there's burning with urination or discharge or fever, back pain, kidney pain. All those things are important in the evaluation process. Other factors include a person's age, whether they smoke. Tobacco use is a risk factor for tons of health issues, but it can also be a risk factor, it's clearly a risk factor for bladder cancer. And it's important to distinguish whether or not the blood is actually in the semen or is it coming from another source, such as the bladder. So that's where the evaluation part comes in. The presence of blood in urine is a huge red flag. You know, depending on the age of the patient, can have a variety of implications. And when blood is found in both the semen and the urine, this can really help in diagnosing the potential cause of this issue. As I talked to earlier about lower urinary tract symptoms, you're going to see this on the internet as LUTS, L-U-T-S, and this could be urgency, frequency, burning, getting up in the night, difficulty holding urine, dribbling, a whole host of other factors that need to be evaluated and worked through. So what I'm getting at here in the end, hopefully will be a peace of mind that this is not at all uncommon problem and that for the vast majority of people it is benign, but the take-home point here, the bottom line, is that an evaluation is required. So I hope you found that helpful in regards to the discussion of hematospermia or bloody swimmers, as I've titled this podcast episode. A little bit clickbaity, if you will, but hey, trying to get the message out there for Men's Health Month. And I've relaunched the course website. You can find that. Just go ahead and click the link below, and let's go.